This is lecture 2 for week 12 of HOS 121, and this lecture looks at aging and the concept of successful aging and theories that relate to that. The lecture begins by looking at the demographics of older adults, looking at changes in lifespan and asking the question if we need to redefine old age, and then looks at factors related to happiness and satisfaction later in life, and the ideas of aging, and then more specifically successful aging, and what contributes to that in terms of looking at different theories of social aging. And this lecture draws on a little bit of week 5 in addition to week 12 readings. So strikingly, the life expectancy in Australia and other Western countries has gone up quite a bit in the 20th century. So in the span of a generation, you're seeing in Australia in 1965 a lifespan, an average of 70, and now in the present over 80. So the current generation is living longer, and the younger generation, people who are children and young adults, if they remain healthy and they don't develop things like type 2 diabetes and obesity and have healthy lifestyles, can expect to have even a longer lifespan than at present. So it begs this question of what does it mean to be old when people are living longer? So do we need to redefine old age? And often when demographers and people who are looking at issues related to the elderly talk about the idea of old age and older adults, they will refer to different groups. So the young old are those from the age of retirement, 65, to about 74. So people in this age group tend to be healthier, maybe even still working, more active. The old would be 74 to 84, and again, this is the lifespan expectancy for most will fall into here, with the lifespan being slightly over 80 as an average. And then the old for people who make it beyond 85, who could make it into their into the hundreds at that point. And so people in this age group are more likely to have some of the chronic diseases and disabilities that can come with being an older adult. In tutorial in week 11, we had a look at satisfaction over the life course, focusing on middle adulthood. But there's a lot of evidence from various studies looking at countries like Australia and similar countries like the United States, doing longitudinal data collection where you ask people the question, are you satisfied with your life? And this chart shows life satisfaction in Australia from the Australian government, that there's evidence of a U-shape distribution where people are happy in childhood, then there's a decline in happiness, a sharp decline from adolescence to the early 20s, and then it continues to decline in later young adulthood to about the mid-30s. You see a period, a kind of a trough, where the middle adult years are a period of lowest life satisfaction, but it begins to improve from the early 50s to the late 60s, and has quite a substantial improvement. And then it remains pretty steady, actually. You can see in older adulthood from the late 60s to the early 80s. And it's actually reaching nearly its highest level during that time. So in what would be the young old and the old. And then it begins to decline a little bit from the early 80s. But nevertheless, if you look at it, it's still showing that people who are the old are actually happier with their lives than people who are in their 20s, which is quite confronting. So you might think about, why would that be, that people would be happier at that point? When we think about older adulthood, and we often think about infirmity and loss of partners, what are the positive sides that relate to people having a good life and feeling satisfied with their lives? For looking at satisfaction with life in later life, research suggests that people who have a high level of satisfaction in later life tend to have certain characteristics, and that includes a lack of significant disease, a high level of cognitive and physical functioning, and an active engagement with productive activity and community with others. So really relating to that idea of generativity, giving to others, and also to the idea of the social convoy, which we'll talk about in a later lecture. Remaining connected to others, remaining involved in a community, having good health, having those qualities tends to make people happy with their life in later adulthood. So there's no question that along with the process of aging, the physical process, health and disability become bigger concerns. So older adults have a greater vulnerability to chronic disease and also to injury. So things like falls are more frequent and more serious for older adults, and chronic health conditions and disease also, become more common. So chronic health conditions like arthritis, heart conditions, vision and hearing impairments, diabetes, other issues can become more common in later life. So there's no question there are physical challenges that go along with aging. The concept of successful aging really highlights how people can find a pathway through later life that focuses on positive outcomes in terms of having good levels of social engagement, having positive health, that enable them to have a high level of subjective well-being where they feel good about their lives. And part of that involves accommodating a normal decline. So there are certain types of decline, physical decline, that go along with aging. So part of the theories that we'll look at talk about how you accommodate that normal decline through trying to control and change your lifestyle, rely on social support, try to control harmful environments, how you use interventions to address declining capabilities, and then also just how you compensate. So we'll talk about compensation as a strategy that people use to continue to have satisfying lives as they age. So there are several theories that look at the idea of psychosocial aging, which is really this combination of social and psychological aspects of people's lives and how that relates to the aging process. So we'll look at three theories, which is the first theory will be continuity theory, the second competence environmental press model, which relates to how people relate to their environments, and then activity theory versus disengagement theory. So continuity theory is about the idea that people use strategies that they've developed over time and familiar strategies to cope with daily life. Basically, that they're using past experience to deal with changes in their lives. And there's a sense of continuity in older adulthood where the patterns that one's laid down earlier can often continue. But it's about having a certain amount of continuity, but not too much continuity. So having too little continuity gives a feeling that life is sort of chaotic and unpredictable, but having too much continuity can promote a sense of boredom and predictability. So really, continuity theory is about finding an optimal level of continuity, of sort of regular strategies in their lives to be kind of manage and keep life being interesting and not overly tax one's resources. So it can involve internal continuity in terms of how one remembers one's past and doing that kind of process of thinking, reminiscing, thinking about one's autobiography. And then external continuity is about how one relates to the external environment, how one relates to social environments and relationships and activities. So it's about keeping those the same, so staying in the same community maybe and having those ongoing important relationships and how that can support people to be successful in their aging. Another theory that looks at the social and psychological aspects of aging, particularly those that lead to successful aging, is the theory called competence environmental press model. And basically, according to this concept, aging is a negotiation between a person's competence levels, their ability to function in terms of their physical health, their sensory perception skills like their vision and hearing, their motor skills, cognitive skills, and their mental resilience. And then the demands from the environment, so the social and the physical and the interpersonal types of demands, and how well they can negotiate that in terms of, are the demands, do they exceed the person's competence level? And when there's an area where there's a space essentially for a person to do well, that's when there might be some slight pressure, but that pushes a person towards more performance, or there's a zone of maximum comfort. The idea that people are able to live without having to worry too much about environmental demands. But basically, this theory highlights another version of goodness of fit, which we looked at when we talked about temperament. It's about how a person fits within their environment and if that person is supported to function within their environment. Then the last theory of psychosocial aging that we'll look at for this lecture is activity theory versus disengagement theory. So activity theory holds that basically if adults remain active at the level that they experienced earlier in adulthood, that will promote a higher sense of subjective well-being. So if they worked, then it's a good idea to go and do volunteer work to maintain similar types of relationships and roles as they did before. Whereas disengagement theory suggests that successful aging involves withdrawing from society in ways that are satisfying to the individual and also work for the society. So, for example, retiring is a form of withdrawing that society needs so that jobs are available to the younger generation, and also works well for people in terms of giving them, time to do other things and when they're getting older. But really, as your reading talks about, you can't say that either of these are a perfect explanatory factor because it really depends on the person. So an interactionist model that looks at the person and the environment and the different elements of the person will hold better, because for some people it will be satisfying to maintain a high level of activity, as was previously the case in earlier adulthood. But for other people, it is satisfying to withdraw more and, as we'll talk about in the next lecture, to be more selective in terms of relationships and roles, and be less active. There's a natural trajectory towards that in older age. So again, it's these theories that look at the fit between the person and their environment are particularly explanatory for successful aging. Finally, we'll look at two contributors to successful aging, and that's spirituality and social support. So spirituality in later life can contribute towards people's psychological well-being. It can be being part of an organized religion and having a religious faith, or just a general sort of spiritual sense of being part of something larger than yourself, possibly a belief in God. So having that kind of feeling, religious feeling or spiritual feeling, helps many older adults cope with life. It can be a source of strength for people they can draw on in terms of challenging times. And those older adults who are more involved with and committed to their faith, in terms of the research, suggests that there's better in physical and mental health than for adults who are not religious. Although you have to kind of disaggregate. There's the religious faith, and then there's also participating in a community, which we know is powerful for people's well-being. And then the final point for this lecture around successful aging is the benefits of social support, which we'll expand on in the next lecture. So social support, especially from family members, has positive health impacts, and the converse, being isolated and lonely, has negative impacts. So it's a well-known risk factor, essentially, a social toxin to be socially isolated, and that includes impacts to speed up the aging process and having impacts on stress levels in the brain. So really, it's, humans have evolved to be with other people, and we'll talk about the idea of the social convoy in the next lecture and other important relationships. Those relationships continue to be important in older adulthood. And when people are socially isolated, for whatever reason, it's helpful for older people to have access to special programs like senior centers, where they can form relationships with others and continue having emotional connections with others. So we'll pick up our conversation now, talking in the next lecture about social relationships and social contexts in older adulthood.